Introduction to Nursing Concepts, Medical Terminology for the Tissue Integrity Unit. This is Martha Olson. Different types of injuries occur that have to be healed. A puncture is deeper in, oftentimes not as visible on the surface, but much of the damage is underneath in the subcutaneous tissue. An abrasion is much more superficial, like if you slide across the basketball floor and have a very superficial like floor burn or rug burn. And a laceration is an injury with tissue that's opened and the integumentary system is injured. Our types of edges should be approximated. That's what we want. Picture A and B are very well approximated. The edges fit together nicely. Picture C is not approximated. The edges are coming apart. Blenching hyperemia is where when you note redness of the skin from dilation of the superficial capillaries. This is a wound that has to be debrided. You can see they are doing mechanical debriding or surgical where they're scraping and using that. When we pack a wound with the wet to dry dressing, we are also doing a debridement. So there are several types of debridement. The idea is to get the slough or the unhealthy tissue off so that the healthy tissue underneath is able to grow and get the oxygen that it needs. Wounds that open up, not a good day at work. When you have a dehiscence, the edges are coming apart, like the picture in the left where you can see about 2/3 the way down. The edges are not approximated. Evisceration is a true emergency, and that is where the body contents or the organs are protruding visceral organs through that surgical wound. It oftentimes happens on an abdomen, especially if the patient has had massive surgery, very unhealthy tissue, the obese person because of the weight and the pulling of those tissues, and also the patient that has the fever. And Potter and Perry will explain the rationale behind that for you. Eschar is that thick layer of dead, dry tissue that covers a pressure area or a thermal burn. Oftentimes that eschar has to be removed by debridement. The fluid that comes out. Exudate is the fluid that comes out. Exudate is considered fluid, cells, and other substances eliminated from the cells or the blood vessels. And if it's purulent, it usually has a lot of protein and cellular debris. It's a thicker, kind of awful-looking type of fluid coming out of your wound. Also, fluid that comes out on page 1183 in Potter and Perry, need to be aware the serous is more of the clear, the purulent we just talked about, the thicker, pussy. What makes it purulent is the dead blood cells that have come to the rescue, and they have to be eliminated from the body. Sanguinous is a bloody type of bright red bleeding, and serosanguinous is a combination of serous and sanguinous, kind of a more of a pink, kind of in between serous and sanguinous. A hematoma is a bruise or a bleeding under the skin. It's a collection of blood that oftentimes will heal on its own, and you can tell the stage of a hematoma by the color. As a hematoma is healing, it turns kind of a yellow-green color, so you can kind of start telling how long that hematoma has been there. A hemorrhage is excessive bleeding. With this one, you can see that the person had an aneurysm or an abnormal bulging of that vessel that broke open and the body is hemorrhaging. Hemorrhage can be internal or external. It's harder to detect when it's internal because the stomach, the abdominal cavity may start enlarging, but you don't notice it as quickly as the person that is bleeding all over the street or bleeding all over everything on an external hemorrhage. Primary and secondary intention. Primary is ideal. Primary means that wound is a very small wound without a lot of tissue loss. It will close easily. The edges can be approximated and it will heal excuse me, with a very minimal scar. Secondary is tissue loss underneath that epidermis, and so you have to heal it from the bottom up so that it grows granulation tissue, and you are not able to close or approximate the edges of the wound because it has to be left open to heal. This is our unit on tissue integrity. Hopefully this has been helpful in preparing you for the unit. Thank you.